Hello, and welcome to Equipping Rhode Island Nursing Home Staff for Substance Use Care, Building Community Partnerships. My name is Nelia Odom, and I will be presenting with my colleague, Kristen Ray Del Sesto. First off, acknowledgements. This presentation was made possible by funding from the Rhode Island Department of Labor and Training. Our objectives today: first, understand the importance of working together with community partners to create a strong collaborative approach to caring for residents with opioid use disorder. Second, examine the role of community programs and local resources in enhancing treatment and quality of life for nursing home residents with OUD. Third, identify key community partners to enhance the management and support of nursing home residents with OUD.
Thank you, Nelia. I'm going to go ahead and get us started with that first objective. Understand the importance of working together with community partners to create a strong collaborative approach to caring for residents with opioid use disorder. So, why partner? Community relationships really do matter. Community partners can provide education, resources, and help reduce stigma around opioid use disorder. You'd think in this day and age that stigma is no longer really an issue in our facilities, but it's actually one of the number one struggles that many of the facilities are having with staff. So a really important piece in getting started. Empowerment and support. Partnerships connect residents to counseling, recovery supports, and ongoing help beyond the nursing home. So we all know discharge begins on admission, and for any of those residents who we are going to be discharging to the community, those recovery supports and ongoing help, having that care plan in place is a really important piece to the resident's success. And then sharing best practices. That collaboration allows nursing homes to learn from others' experiences and adapt those proven strategies. Community relationships help individuals with opioid use disorder overcome barriers to care by providing coordinated, team-based support. Building strong community relationships is a key to supporting residents with OUD throughout their care. Working together as a community helps remove barriers, again, reduces stigma, and keeps residents on their medications and ensures their treatment continues after discharge. Community relationships equip us to effectively support individuals with OUD. A collaborative, multidisciplinary approach helps to improve their lives in a way that are important to them, giving them the tools, skills, and resources to manage their OUD treatment. We want to help residents maintain their OUD treatment and ensure continued access to medications after discharge. We also want to transfer ongoing care to primary care providers and other community resources. It's very challenging for residents to successfully link to resources they're not familiar with. The strength of your relationship with other providers in the community can be that bridge that helps them get the services they need. Now let's look at how partnering across the full continuum of care can strengthen support for residents with OUD. Working together from nursing home to outpatient helps ensure seamless and coordinated treatment, leading to better outcomes. healthcare and clinical partners. Local hospitals and addiction treatment centers provide specialized care, medication-assisted treatment, and care coordination. We want to facilitate smooth transitions for residents returning from hospitalization or detox programs. Behavioral health providers and mental health clinics support co-occurring mental health conditions, which we know is very common in residents with substance use disorder. We want to offer counseling, therapy, and group sessions. Primary care and geriatric specialists ensure ongoing management of chronic conditions alongside addiction care. Then when we look at community-based and peer support organizations, we want to think about those recovery and peer support networks that provide peer mentoring and group meetings and lived experience support. That really takes the facilities a bit of out of the box thinking. It's not something that we're generally accustomed to doing day in and day out with our, shall I say, traditional residents in the home. In the long-term care facilities, those coming in with a secondary diagnosis of substance use disorder, opioid use disorder, really require us to seek out our community partners, our recovery peer support networks and community-based organizations to provide that holistic approach and person-centered care to our residents. Consider faith-based community support groups as well. Help address isolation and build social connection and support recovery motivation. We know that many individuals with substance use disorder have sometimes either don't have family for that support, may have burned some bridges along the way, and so it's really important for us to help address that isolation and build other social connections. Public health and governmental agencies, your local health departments, can also assist with the care of your resident. They can assist with harm reduction resources, such as naloxone distribution and safe prescribing education, support staff training, and community outreach. We also have substance abuse prevention coalitions that may bring expertise, educational materials, and community programming. Social services and housing supports help residents navigate benefits, transportation, and social services. Senior centers or adult day programs can create meaningful social engagement, reducing isolation that can exacerbate substance use. Harm reduction and advocacy groups can specialize in harm reduction, such as your local syringe service programs, provide training for staff and residents on overdose prevention, distribute naloxone and educational materials safely. We also have family and caregiver networks that can educate families about SUD and OUD, relapse prevention, and support strategies. We want to include families in care planning to improve continuity, and that really all falls into that person-centered care approach. We want to include the resident in the care planning, and that's when you really know that you have person-centered care in your facility, when you can ask yourself, is the resident involved in the decision making of the care plan? Are they involved with the day-to-day care? Are they well informed? Do they make decisions with the care team? And the answer is yes, then you know you have a person-centered approach in your facility. And then, of course, we have transportation services, which are help with that is always welcome, and opioid treatment programs. So, with that, that's a good segue to discussion about partnering with an opioid treatment program. It is recommended that skilled nursing and other long-term care facilities partner with an opioid treatment program for on-site methadone maintenance services to avoid the need to transport medically vulnerable patients or residents off-site. Um, it can really put a strain on the facility when you are having to individually transport those residents off and back on, back and forth to an opioid treatment program. So having that partnership with the OTP for methadone maintenance just makes the care all that much more efficient. Medication for opioid use disorder includes prescribing medications such as methadone, buprenorphine, or naltrexone to treat OUD. In skilled nursing facilities, MOUD can help manage both pain and OUD, improving the overall quality of life for residents. These treatments can be life-saving, especially for patients who have struggled with opioid dependence. So let's bring the community partners into the facility. Why not, right? Um, there are many places across the state of Rhode Island where individuals can participate in recovery services. Recovery community centers can provide support from others with lived experience and offer support groups, basic needs, housing, family supports, financial literacy classes, and health and wellness activities. Community partners such as telehealth, warm lines, peer support, those group meetings. Again, it's not a service that we may be as familiar with providing in our day-to-day interactions or activities with the residents. But they are out there. There's a lot of resources at your fingertips. And, one of the biggest and probably simplest question that we get is, well, where do we get started? How do we get started? How do we get started with an outpatient treatment program, an opioid treatment program? And usually the answer from either the OTP or from telehealth or peer support is just call us. Just pick up the phone and call. And it's really as simple as that. And if the person you call does not provide that service to your facility, chances are they'll know who does. And so with that, we will talk a little bit more about where you can find some of those resources and begin making those connections and building those community partnerships. And I will turn it over to Nelia. Nelia, take it away.
Thank you, Kristen. Here you will find the Rhode Island Substance Use Disorder Resources, a guide for healthcare professionals. Healthcare professionals can use this guide to refer patients of all ages to services from crisis management and harm reduction to treatment and support. Other resources that are available are found here. Health-centric advisors in partnership with Connecticut Department of Mental Health and Addiction Services and the Connecticut Department of Public Health, developed a comprehensive resource guide for long-term care facilities to begin caring for residents with OUD. The guide, Strategies for Supporting Residents with Opioid Use Disorder in Long-Term Care, is also found here. Also, you and your team are able to access companion education modules on the LMS that has been shared with you. Lastly, here is our contact information, and we would like to thank you for your dedication to this important work.